Welcome back to the Healthcare GTM series podcast by Medic Prospects. In episode 3, we discussed the rise of account-based marketing in healthcare. We explored how account-based marketing, or ABM, is helping healthcare organizations move beyond mass marketing to focus on high-value accounts. We also looked at how larger buying committees and personalized engagement are reshaping healthcare sales and marketing. If you missed that episode, be sure to check it out. Today, in episode 4, we're discussing how AI is changing healthcare GTM. Smarter marketing, faster sales, better growth. So imagine spending $50,000 to market, like a groundbreaking new MRI software platform.
Right, a massive investment.
Exactly. You have these beautifully crafted email sequences, perfectly optimized landing pages, a stellar value proposition, but you launch the campaign and nothing happens.
Yeah, crickets.
Because your algorithm sent your pitch to a hospital procurement chief who actually retired 6 months ago, and to an IT director whose hospital network just got acquired and froze all software budgets. So today, we're taking a deep dive into the actual mechanics of artificial intelligence in healthcare go-to-market strategies.
Yeah, we really need to strip away all those sci-fi buzzwords,
Yeah.
We're looking at how these tools practically function on the ground for your GTM teams.
Right. And our mission for this deep dive is to unpack how AI isn't just some emerging tech trend anymore. It is a concrete, necessary competitive advantage.
Absolutely. And the foundational shift we have to understand before looking at the tools themselves is that AI in this space is it's an amplifier of human decision-making. It's not a substitute for it.
Right. It's not replacing you.
Exactly. The sources we're analyzing today map out a very specific reality. If you're a GTM professional, the real value of these machine learning models lies in their ability to process just vast, unstructured data sets.
Like web traffic, email engagement, CRM records, that kind of thing.
Precisely. It takes all that noise and translates it into actionable revenue signals. We're looking at how you can use these systems to make faster, smarter decisions across what is, frankly, a highly complex buyer journey.
Well, and before we can even touch on how you use AI to sell your product, I think we have to flip the perspective. You really have to understand how the modern healthcare buyer's behavior has just fundamentally rewired the entire sales process.
Oh, 100%. Because if you're trying to sell to a hospital network today using, like, the playbook from 2019, you're going to hit a brick wall.
Yeah, the buyer is no longer sitting around waiting for a sales rep to educate them on the state of the market. It's a lot like a patient Googling their symptoms and using AI chatbots before going to the doctor.
That is a perfect analogy.
Right. By the time these healthcare buyers finally reach out to a vendor, they've already diagnosed their organization's problem and are just looking for the specific cure.
Yeah. And the telemetry data on buyer behavior proves this definitively.
Yeah.
A modern healthcare buyer, whether that's a chief medical officer or, a VP of operations, they are spending weeks mapping out their own solutions digitally.
So they're leaving a pretty massive digital footprint while they do that.
Massive. They're reading industry white papers, attending virtual webinars, downloading technical specs. They're out there comparing vendors on third-party review sites.
So by the time they actually fill out a form or accept a meeting with your team, the decision is often already, like 70% made?
At least 70%, yeah.
Right.
They aren't looking for a basic pitch anymore. They're looking to validate the highly specific conclusions they've already drawn.
So if they are essentially diagnosing their own operational pain points long before you even know they're in the market, your traditional aggressive cold outreach is just dead on arrival.
Completely dead.
I mean, if you hit a hospital executive with a generic high-pressure cold call while they are deep in the weeds of evaluating integration protocols, you aren't just being ignored. You're actively signaling that you have no idea where they are in their buying journey.
Exactly. You're showing them that you're out of touch. Earning that trust requires a huge paradigm shift from outbound interruption to inbound education.
Right. You have to be the one providing the medical journal they are using to self-diagnose, so to speak. You have to establish absolute trust through upfront educational value.
Yeah, and if a procurement team is evaluating cybersecurity platforms for a regional clinic, they need deep authoritative content to guide that research. The organizations winning today are the ones publishing the definitive guides on high-pay compliant cloud storage.
Or, hosting the webinars on mitigating ransomware in patient databases. Acting as a resource, rather than a vendor, is the primary mechanism for capturing attention now.
It really is. But let's look at the operational side of that. If the buyer demands weeks of self-education, That puts an impossible burden on your marketing team.
Oh, totally. If you are running this GTM strategy, you suddenly need a massive, continuous pipeline of valuable material. We're talking blog posts, newsletters, video breakdowns, technical case studies.
And social media thought leadership.
Hmm.
Manually writing and producing that volume of high-level healthcare content is completely unscalable for a standard team.
Right, there just aren't enough hours in the day, which is where AI transitions from being a novelty to an absolutely mandatory drafting engine, right?
Exactly. The application of large language models, or LLMs, fundamentally solves this bandwidth constraint.
Uh-huh.
But it's vital to understand how it functions under the hood.
Yeah, you aren't just telling a chatbot to write a blog about healthcare.
Right. You are using natural language processing to ingest dense proprietary information and restructure it. So say your product team gives you a 50-page clinical efficacy report on a new diagnostic tool.
Dense stuff.
Very dense. An AI tool can parse the semantic relationships in that PDF and instantly generate a structured blog outline, a 3-part email drip campaign, and 10 social media variations.
Wow, so it just identifies the core technical arguments and translates them into digestible formats in seconds.
Exactly. But I know what you're going to ask next.
Well, yeah, I have to push back a little here for our listeners. If everyone is using AI to quickly pump out all these blogs and newsletters, doesn't it all run the risk of sounding exactly the same? Where does the human expertise actually fit in?
That is the million-dollar question.
Yeah.
And the distinction here lies in how you utilize the output. AI is a powerful drafting tool, not a final publisher.
So the organizations that sound like generic robots are the ones just copying and pasting first drafts.
Precisely.
Yeah.
In a highly regulated environment like healthcare, human oversight for compliance and accuracy is what separates quality market leaders from the noise. An LLM operates on probabilistic text generation.
Just guessing the next most likely word.
Exactly.
Yeah.
It does not understand FDA compliance, it does not understand high-pay marketing guidelines, and it certainly doesn't understand your unique brand voice.
Right, and if you let an AI accidentally make an unsubstantiated clinical claim about your software, your GTM strategy suddenly becomes a massive legal liability.
Exactly. The human provides the domain expertise, the regulatory guardrails, and the strategic nuance. The AI simply removes the friction of the blank page.
That makes total sense. The AI frames the house, but you have to do the wiring and the plumbing to make sure it actually functions safely.
That's a great way to put it.
So let's follow this workflow. You have this compliant, human-polished content engine running at scale, but having a library of incredible content is useless if no one visits it.
Right. The old approach was to buy a massive list of emails and blast the same generic white paper to 10,000 inboxes.
Just hoping a fraction of a percent accidentally clicked it.
Yeah, and that batch and blast methodology is exactly what AI makes obsolete. We are moving into precision targeting through predictive lead scoring and hyper-personalization.
So instead of treating your database as a monolith, machine learning algorithms analyze multiple layers of data simultaneously to build highly targeted audiences.
Exactly. They look at firmographic data like the size of a hospital and its revenue. They look at technographic data like what electronic health record system they currently have installed.
And behavioral data, right? Like how often a specific contact engages with your digital properties.
Yes, and this allows for personalization at scale. You're delivering unique, relevant messages tailored specifically to physicians, hospital executives, nurses, IT leaders.
It's the difference between standing in a crowded hospital lobby shouting your message through a megaphone versus walking up to the IT leader or the procurement officer and whispering the exact solution to the specific problem they are facing that day.
That is exactly it, because relevance drives engagement. Let's look at the complex healthcare buying committee. You have the CFO, who is solely focused on bottom-line ROI and operational efficiency.
Right.
Then you have the head of radiology, who only cares about image clarity and patient workflow. And you have the IT director, who is staying up at night worrying about data security and API integrations.
So sending all three of them the same case study is a complete waste of digital real estate.
Exactly why a hospital executive and a nurse require entirely different value propositions. And AI seamlessly bridges that gap at scale.
It integrates with your CRM to automate this matrix, right?
Yes. The system recognizes the job title and historical behavior of the recipient. When the campaign launches, the algorithm dynamically swaps the content blocks.
Oh, wow. So the CFO receives the message highlighting cost reduction metrics while the IT director gets the security certification.
Exactly, simultaneously without manual intervention.
Okay, so marketing is humming. You've generated the content. You've targeted the committee. The buyers are reading the case studies. Now comes the handoff. How does the sales team actually know who to call?
Well, AI analyzes buyer behavior and engagement signals to identify which accounts are actually ready and interested in a product. It's called intent data aggregation.
Because traditionally, a sales rep wakes up, looks at a list of hundreds of leads, and just starts dialing, hoping they stumble across someone with a budget.
Right, and AI replaces that guesswork. It acts as a sophisticated translator of digital body language.
Digital body language, I like that. So if a specific hospital network hasn't filled out a single form on your website,
The AI tracking your web properties still notes through IP resolution that multiple users from that hospital's network are suddenly spending 15 minutes on your API integration page.
while simultaneously attending your technical webinar and clicking the pricing links in your emails, the algorithm is connecting the dots across different platforms. It sees the pattern that a human would miss.
Precisely. It aggregates those disparate digital footprints and runs them through a predictive lead scoring model. The AI flags that account and alerts your sales team.
Essentially saying, hey, this specific hospital is showing a massive spike in research behavior regarding your exact solution.
Yes, this prevents sales professionals from wasting time on prospects who aren't ready. Your sales team wakes up to a prioritized dashboard of high-value conversations.
I have to challenge this, though. Let's address the elephant in the room for our listeners.
Okay, let's hear it.
If AI is doing all the targeting, reading the engagement signals, and telling us exactly who is ready to buy, aren't sales teams worried this technology is coming for their jobs?
It's a common fear, but the source material definitively debunks this. AI isn't replacing sales teams, it's making them remarkably more efficient.
By taking away the grunt work.
Exactly. Think about how much of a traditional sales role is consumed by non-revenue generating tasks. Digging through fragmented databases, writing repetitive follow-up sequences, cold calling prospects with zero intent to buy.
Right, nobody enjoys that part of the job anyway.
Exactly. By stripping away the grunt work of blindly chasing cold leads, AI frees up human salespeople to do what machines fundamentally cannot simulate, build genuine, trust-based relationships with ready buyers.
When you only focus your energy on high-value conversations, your close rates climb, your sales cycles shorten, you empower the human to just be human.
Right. The job transitions from being a human spam filter to being a strategic consultant.
Okay, I see that. But this entire ecosystem, the intent scoring, the dynamic content swapping, the hyper-personalization, it's all built on an assumption, isn't it?
What do you mean?
It assumes the machine actually knows who it's talking to. You can buy a $1 million high-performance sports car representing the best AI tool on the market, but if you fill the tank with cheap, contaminated fuel, that engine is going to sputter and fail.
You've just hit on the critical failure point of modern GTM strategies. AI is only as effective as the data behind it.
Right. The AI model is completely agnostic to the truth. It only knows the inputs you feed it.
Exactly. Outdated or inaccurate customer info leads to unreliable AI recommendations. If your CRM is plagued by duplicate records or unverified contact information, the AI's predictive scoring becomes worse than useless.
It becomes actively destructive to your brand. Because in healthcare, data decays at an astonishing rate. Hospital networks merge, physicians change specialties, procurement officers switch facilities.
Yeah, and if your predictive algorithm uses 3-year-old CRM data to hyper-personalize a sales sequence to a chief medical officer who left a year ago, you aren't just wasting an email.
You are broadcasting to that entire hospital system that your company is sloppy and entirely reliant on automated spam.
That is the exact scenario that destroys trust. This is why AI and high-quality data are inseparable partners.
So healthcare organizations must invest in verified, regularly updated, and well-organized data.
Yes. Continuous investment in data hygiene isn't just an IT chore, it is the most critical pillar of modern marketing and sales success. Quality data directly improves campaign performance, audience targeting, and decision-making.
Okay, so clean the data, feed the algorithm, empower the humans to build relationships. That makes total sense for right now. But if we pull back and look at the horizon, how is the buyer's use of AI going to force GTM strategies to evolve even further?
This is fascinating. More professionals are beginning to use AI assistants to research vendors, summarize info, and compare products before ever contacting a company.
Wait, so we aren't just creating content for doctors and hospital execs anymore. We actually have to optimize our content so that an AI assistant can easily read it and recommend us.
Exactly. It's a massive shift. Being AI readable is the next frontier of digital visibility.
So if your most valuable case studies are locked behind unreadable PDFs or gated forms, the AI research assistant simply won't see you.
Right, you won't even make it onto the buyer's initial shortlist. Because of this, healthcare organizations must create content that is not only valuable for human readers, but also easy for AI-powered platforms to understand and reference.
So strong digital visibility and trusted information will position companies to win as AI becomes a bigger part of the buyer's journey. Educational, trusted information is basically the currency of the future.
It really is. To summarize the core message from everything we've covered today, the future of healthcare marketing is powered not just by technology, but by technology, data, and people working together to create better experiences and outcomes.
Which brings us to a really fascinating, almost paradoxical thought to leave our listeners with today. If your healthcare buyers are increasingly using AI to do their research, and your sales team is increasingly using AI to do their outreach,
We might be rapidly approaching a world where the AIs are essentially having the first meeting with each other.
exactly.
Yeah.
As a professional, how will you ensure your human empathy and expertise still shine through when the machines are doing the initial talking? Something to think about.
Thanks for listening to the Healthcare GTM series podcast by Medic Prospects. If you found this discussion valuable, don't forget to subscribe and follow the series for more insights on healthcare marketing, healthcare sales, healthcare data, AI, physician outreach, demand generation, and the latest trends shaping the healthcare industry. To learn more about our healthcare marketing solutions, verified healthcare databases, and industry insights, visit www.medicprospects.com. We'll see you next time as we continue exploring the strategies and innovations driving the future of healthcare growth. Until then, thanks for listening.